patients present with these limitations. And what we've been doing, especially over the last 10 years or so, is not just digging into the diagnosis. And in fact, we've even seen, the ICD classifications change. We've got more of them that are related to function, or I should say, dysfunction. And I've always used the example down here. So there's an article by Gose et al. In 1998, and it was on spinal decompression therapy. And if you look at what they had for patient population, now it's not a randomized control study that would have changed things, but it's a retrospective case series. And the age range was 18 to I think it was 72 or 78, and basically all had the same diagnosis. Well, yeah, they may have the same diagnosis code, but I promise you, an 18-year-old is not the same as a 72-year-old, or even just looking at the mechanisms associated with what, part of their problem is. And we often, kind of jump to the label of like chronic low back pain. Oh, well, it's chronic. That's what brought them in. Therefore, I immediately deal with, a protocol that delivers a chronic set of parameters. And in a sense, that might actually be more problematic, and you could create more issues for the patient if you do so. In fact, I was just contacted by a colleague of mine out in California, and he was asking me about decompression, and he was just seeing a patient who was pulled too hard, who ended up with Cauda-Equina syndrome, and subsequently in the ER had surgery 24 hours later. Now, he's not saying that it was because of the person themselves, but it sounds like they did potentially overtreat when not getting all of that. Yes, chronic low back pain, it's a chronicity. They've had it for a long time, but what stage are they at? Like, what's going on inside? And well, we could look inside, then that would be great, but we don't. So we have to take various types of studies and tests that we might not be able to see inside, but it might be a performance-based outcome measure. So we need to make that consistent with what it is that we're doing, and that's the challenge. Is we can't see inside all the time when we get some of these rather sort of acute exacerbations.